One of the interesting things is that it takes a very long time for changes in terms of medicine. 17 plus years is the time from which we first realized, whoa, this was really good, to finally everybody's doing it. In fact, some of the things I talked about in terms of stem cell activation were actually reviewed by Governor Brown. And he asked that question, why isn't everybody doing certain things that we just talked about? And what we're talking about is how to make stem cells grow out of cells that were decaying, denied acquiescence to what was happening, and became normal. This is really exciting. So right now there's something that I'm going back a few years to look at, a piece that I pulled together, and it's about people who have had diabetic neuropathy. I can recall when I first came to California in 1968, one of the last articles I ever read about how neuropathy and retinopathy occurred was very exciting, because you really realize there were small vessels, kinds which you have to really look through microscopes to see. And now we're doing it every day. We're looking at everything. But some things we're so good at now, we don't have to worry about it anymore. That means a little hoity-toity on our part, but retinopathy is something we just don't see anymore. I've had about 17 really good letters from ophthalmologists who are really good, and they said so. They were really good. They were doing wonderful things, but what we were doing was taking everything and making them go away without the retinopathy, the laser treatment, and all the things were in the back of the eye. We haven't had any in years and years. The ability to look at other things that are like microscopic things are really important, but the really exciting thing is that somebody realized it was a really good thing, and you didn't, from 1968 on, went on through a situation where I couldn't worry about anybody's getting retinopathy and needing laser and so forth. So we really don't do it very often. We've never seen it happen, but it happens occasionally when people are over-treating with too much insulin, over-treating with sulfonylureas, trying to get their A1C down, and they're young and they're really not that bad a person with diabetic, and so they get hypoglycemia, growth hormone comes out, everything is bad. So we understand those things now, and although we're not perfect on everything, we really got excited about the fact that we don't see blindness. The only people we have in the practice which have problems with their eyes have been something done 20, 30 years ago, and it's not that way anymore. So it's really our time to realize that there are major things are going on, and everybody just needs to say, hey, I got something, can you take care of that? There's a plethora of things that we can do, so we just need you to tell us what you want. What is their problem? What is the complication? And we have a very good chance of really making it all right. It's your time.